You're watching EAC News. Thank you for joining us. Only 7% of the African population has received 2 doses of COVID-19 vaccines, the WHO's Emergency Director, Mike Ryan, has said on Tuesday. In comparison, over half of the world's total population has already been double vaccinated. Speaking during a virtual panel on vaccine equity at the World Economic Forum, the World Health Organization's Emergency Director, Mike Ryan, has stressed that we are leaving huge swaths of the world behind. Africa CDC Director John Nkengasong has echoed Ryan's statement, saying that there is no reason for Africa to be lagging behind other countries. He says that what we have seen over the last 2 years is a total collapse of global cooperation and solidarity. The CEO of the Vaccine Alliance, Gavi, Seth Barkley, has said the challenge with developing countries is giving them the tools, the finance, and the planning time to be able to roll these products out. On Saturday, 15th January, the COVAX Global Vaccine Sharing Program has said it has delivered a total of 1 billion COVID-19 vaccine doses.
Now, over half the world's, if we look at the population of the world, in total, over half of the world's population has received 2 doses of vaccine. But if we look at in Africa, in our African regional office states, only 7%. So the reality is that the world is moving towards a 70% goal. The problem is we are leaving huge swathes of the world behind.
So we're going to see a shift in the trends, hopefully, and probably supply 1 billion plus doses in the first quarter or 2, combined through COVAX to the African continent. So we're in a far different and better place than we were last year.
So what we have seen over the last 2 years is really total collapse of global cooperation and solidarity, period. I think there's absolutely no reason why a continent of Africa should be lagging behind with having 7% of the population fully immunized. A continent of 1.2 billion people is totally unacceptable.
Supplies to poorer nations have long been very limited because of a lack of vaccines, as wealthier states secured most of the doses initially available from December 2020. COVAX was launched in 2020 with the goal of delivering 2 billion doses by the end of 2021, but was slowed down by wealthier states' initial hoarding of limited shots, export restrictions, and frequent changes within its organization. Gavi, a vaccine alliance which co-manages COVAX, is seeking more funds to reach the WHO's goal of vaccinating 70% of the population in poorer nations by July.